How you guys doing? This is what we would do with a normal patient coming in for assessment and adjustment.
This is assuming I'm a normal patient, which I am not.
So I start with checking the pelvis to see if it's a functional or structural short leg. And he has a history of already being a functional short leg, so I know that. So I'm just looking to see what side I want to adjust today. And so I can take the torque out of the pelvis. I start by checking the pelvis at the PSIS, or the posterior superior iliac spine. And then we go up the spine and check for restrictions. There's so many different ways to palpate and check for motion palpation. And it's just kind of dependent on the individual, and it's dependent on the chiropractor. So it kind of all depends. Alright, let's go both hands under your thighs. There we go. And just relax for me. Take a breath. All the way out. Good. Again, breath. All the way out. Good. Okay. Land your left side. Face me. Good. Good. Bottom hip towards me, just a little bit more. Good. Again, a lot of ways to adjust. People use devices to adjust, such as what I don't have in this room.
Is it like it's like a little
Yeah, it's called an activator, but there's a little different tools. They call them adjusting tools, chiropractic adjusting tools, or CAT tools. But I'm more of a manual adjuster. I will always manual adjust unless someone requests it. They're osteoporotic or they're a child that needs very gentle adjusting. Breath in. Again, breath. Good.
For treatment purposes, what do you suggest? I mean, the average person, they come in once a week, twice a week. I mean,
it all depends on their finding. If they're actually in pretty good health and they're moving pretty well, I would do wellness, which is once a month, twice a month maybe, all the way to a triathlon, which or triathlete, where I am a chiropractor for many. They sometimes are just so stable because their lifestyle is working out. So they would end up getting adjusted maybe 2-3 times a year because they're just that stable. So it's all about stability. So I would only adjust as there is a level of instability, and as I get more stable, there's a less adjusting necessary.
Okay.
So I should sorry.
Go ahead, keep continuing.
So yeah,
so one thing is with you can keep going. As I was having really bad hip pain and just a lot of issues. I run quite often. I mean, my ability to run is just dramatically increased.
Take one.
Ever since I've been coming to Dr. J, but the thing is that I come in about once a week, pretty consistently. Sometimes it's once every 2 weeks.
Yeah, Nico and Eastbound. Yeah, we started probably pretty frequently, and then I mean you were coming in, and so as you got more stable, we decreased your frequency of visits. You become more stable the tighter you get with exercises and strength, and we did that before already. So all my patients would get strengthening, probably 6 to 12 visits in, as the muscle memory starts to listen to what I am actually trying to get accomplished. So right there, what it is, I rechecked your leg length just to make sure that I did something, and so for the most part, you were back to even. So it's kind of the whole idea. Come down just a little bit. Good. Knees back. Good. Come around. Hold nice and tight for me. Take a breath all the way out. And again, breath all the way out. Last one, breath all the way out. Good.
I think it's one thing also, hearing that sound and me not being a specialist, I think, oh, that's what I need to do. When he's not there and adjusting, you should probably, that's not good, right?
No, yeah. Self-adjusting is, especially in the neck, is one of the leading causes to stroke. So self-manipulation is one way to term it. The other one is if you adjust a certain area all the time, you create hypermobility or very flexible joints. Well, those areas that you will never be able to get to end up becoming hypomobile, which means they will not move, and they will end up generating a problem in time because those are the ones that will be so restricted of normal motion.
Translation, self-adjust bad.
Thanks. Also, the pop that you hear is basically gas leaving the joint.
Yeah.
It's not completely necessary for the confirmation of a successful adjustment. So typically, everyone says, "Oh, I didn't pop. Oh, it didn't go," but really, is the motion restored from when I first checked it to after the adjustment? And I always check my joints to make sure that they are moving better than before I adjusted. So
About the alignment, not about the popping.
that's it. So hold tight on this side here, and this side is loose.
Yeah.
There. So this is a rib adjustment. Take a breath all the way out.
That's much better.
Good. All right, switch your arms. Good. Perfect. Actually, this one's going to come this way. This one hangs out. This one's tight. Tell me if there's anything sore.
See you later.
It's not that. Oh, right there.
There. Take a breath all the way out. Good job. Go over to your neck. There. Take a breath all the way out. And you'll and again, breath all the way out.
All that computer work, really good, right?
Not.
Hey,
So
social media.
So how you do benefit. Breath in, all the way out. It's anyone that has that habit of either looking down, bad posture, manual labor, lifting, any of that will work against a normal God-given posture and function of our body. So in chiropractic, it's one element to restore flexibility and get rid of that restriction in the joint element, and that helps with muscle. But then it's also re-educating that muscle through exercise that will hold those things in place. So
I think one of the biggest things, like especially with me learning over time with all the computer work that I've done, that if I don't get adjusted, I get headaches. I get like even blurred vision. Like it's because everything's connected all right here. I mean, if you get a pinched nerve, I mean, you're out of commission, and so a lot of the issues you might have with like headaches, migraines, whatever it may be actually a cause from misalignment rather than actually your body kind of falling apart or whatever. You know what I mean?
all right. So now let's show them how to get up from a laying position. Remember how to do that?
Yeah, I do like a front flip.
Yeah, front flip. There you are. Very good. Sweet, good. Keep it up.
Thank you, Doc Jeff.
My pleasure.